Philip Morgan from the University of Manchester, and welcome to the next presentation in my series relating to the important clinical issue of contact lens discomfort. In this talk, I'm going to be talking how we can go and actually quantify contact lens discomfort. Well, in practice, this is best done really using some form of questionnaire. This can be, I guess, relatively complex using a questionnaire like this one, the contact lens dry eye questionnaire. It's an 8-item questionnaire that looks at discomfort, dryness and vision. It also asks about eye closing and removal of lenses. What's interesting about this questionnaire is that it has been validated, so they've used this on a lot of contact lens wearers, and they found that people getting a score of 12 or greater probably require some sort of intervention related to their contact lens discomfort. So it might be almost a bit over the top to use in practice, but it comes with these very clear indicators of when something needs to be done. In this case, of a score of 12 or more requires some sort of intervention, and also has this interesting characteristic that it's been shown that a change of 3 units or more is clinically meaningful. Now, it would be, I think, impressive, but maybe a bit over the top to do that on every contact lens wearer at all visits. But I think the issue of discomfort should be addressed at all contact lens aftercare visits, maybe simply here with a 0 to 10 scale. And I think if somebody's getting 5, 6, maybe even 7, I think we need to start to thinking about doing something there. If at 9 or 10, maybe less so, but lower scores I think may be a sign of some form of intervention being required. So how can we understand exactly what's going on here? Let's have a look at some scores for how contact lens wearers do through the day, and I'm indebted here to this work of my former PhD student Maria Nevazquez, Coronago. What she did is she got a bunch of daily disposable contact lens wearers, and she looked at what happened through a 12-hour wearing day. And on different days with these people, she did one of 4 things. On one of these days, she actually did nothing halfway through the day. On another day, halfway through the day, or more specifically after 5 hours of wear, the lens that they were wearing was taken out and a fresh lens was put back in. On a different day, the lens was removed, rinsed and replaced. And on a further day again, the lens was actually just moved onto the sclera to allow for some blinking and then moved back on again. The purpose of this experiment was to quantify contact lens comfort over this 12-hour period, but also try and understand if some sort of intervention part way through the day might help us appreciate whether the lens is changing through the day or the ocular system, the eye, is changing through the day. Now, in order to get her data, what Maria did was everybody got an analog scale, a visual analog scale to sort of take away and look at to guide them as to what scores we were interested in. But on a number of occasions through the day, every 2 hours, subjects were sent an SMS message that said, please give us a score for the comfort with your contact lenses, and with reference to this sort of scale, they responded back to us with a score for their comfort of their right and left eyes. And here's what she found. So this was done over a 12-hour day, scores out of 100. And what you can see here, on the day where nothing happened partway through the day, well, you can see that for the first few hours of contact lens use, scores remain relatively high. I should say that the first score given here is prior to contact lens application, and then the second score at something like 80 units just after the lens have gone in. And we get scores of about 80 for 4 or 5 hours into the day, but thereafter it seems to fall more significantly, so that on average, after about 12 hours of contact lens use, we're getting scores of something like 60. So we see this steady deterioration on average of contact lens comfort, particularly in the second half of the wearing day. Now, what happens when we intervene at that 5-hour point? Well, when we put a new lens in, so the patient came in, 5 hours, lens was removed and a new one put in, maybe there's a bit of an initial improvement after that's happened, but by the end of the day, the scores are still at something like that 60 point. We've made no difference at the end of the day. And it's a similar sort of story whether we take the lens out, rinse it and put it back in again, or if we just move the lens, the scleral swish, we move it across the surface of the eye and return it at this 5-hour point. We're getting to the same point at the end of the day. So what does this mean? Remember, we're trying to answer the question of what is changing over the day. Is it the eye or is it the lens? Well, if it was the lens, then I think we would have expected to see increased comfort scores at the end of the day. Certainly when we applied a new lens halfway through, we didn't see that. So we have to surmise that there's something about the local ocular system, something about the eye that's changing through the day that's giving rise to these reduced scores. We've tried to do this and calibrate this and measure this using different approaches. Here's one where we looked at, we had people wearing this wrist-mounted logging device, a sort of a watch type device. Every time you touch it, it would record a score. So we got contact lens wearers to do this, and actually as the day went on, we could track the presence of the lens. There's an accelerometer in it, so we could see when they were wearing that lens on that upper scale. But then we could look at actually their scoring through the day. So we got the start of the day and then the end of the day where lenses go in and then get removed. And actually through the day we've got these different color-coded clicks that they delivered, with a single click meaning a mild discomfort, a double click meaning a more significant level of discomfort, and a triple click meaning really quite noticeable, quite uncomfortable levels of discomfort. And we got a range of contact lens wearers to use this device, and we see something similar, that the number of clicks, the number of responses increasing as the day goes through. Once again though, we're sort of towards the end of the day when this is kicking in. Many hours in the early and middle parts of the day, we're not seeing too much of the clicking activity, but it really ramps up towards the end of the day. So here's another measure of how contact lens discomfort is essentially an end of day problem. But we have to remember that this is not just an issue with contact lenses. We can see discomfort with spectacle wearers as well. This is a beautiful study done by Eric Papas and colleagues at the University of New South Wales. What they did here was they compared discomfort, particularly overall discomfort through the day and end of day discomfort in contact lens wearers versus people not using lenses or wearing spectacles. So here are the data that they collected. I'm going to be showing the numbers here with initial comfort shown along the x-axis at the bottom, and all of the scores are compared to emmetropes, compared to people not using contact lenses. So they get a score of 0 there. And up the y-axis we've got relative end of day comfort scores. So again, we're comparing the contact lens groups and the spectacle group to the emmetrope. So here's one of the contact lenses, Lens brand A. Now what they found is that there was quite a big drop for end of day discomfort. The scores are quite a bit lower, about 0.8 units on a 0 to 10 scale here, lower with the contact lens than the non-wearers. Actually, the initial comfort is not very different, just very marginally down with that particular lens. Well, what's important is that they, as part of their work, have this, they found this limit for clinical significance. So anything that's inside that dotted line, and close to the emmetropes, really no difference in comfort for that particular product versus the emmetrope. So this is an average score. So though on average, this lens is just about clinically similar to people not wearing contact lenses, but that does mean that probably half of people using this lens would be noticeably less comfortable when wearing this lens than if they weren't using contact lenses. And here are the other contact lenses that they examined. Again, one or two fairly close to this boundary of clinical significance. So on average, not much difference with an emmetropic non-lens wearing group. So that's about as good as we can get with a contact lens. And again, that means probably half of wearers would have a noticeable difference. And one or two brands that appear to be a long way from the comfort that emmetropes report. So overall, the best we can get is sort of approaching what emmetropes feel when we have people wearing contact lenses, but quite a few brands are noticeably different, noticeably poorer for contact lens discomfort. Interestingly, things are not perfect with spectacles. A lot of spectacle wearers complaining about the sort of discomfort or inconvenience of using their spectacles as well. So in fact, setting the bar at non-lens wearers is a particularly high one for contact lenses. So what do we know? Well, we can measure contact lens discomfort. It would be nice in practice perhaps to do the full questionnaire thing. That would give us some benefit, but I think just scoring a number from 10 is probably a reasonable thing to do. But I do think because of the importance of this issue, it needs to be done at each and every contact lens follow-up or aftercare visits. Now specifically, discomfort that we see with modern soft lenses is something that's happening towards the end of the day. Comfort through the early parts and deep into the middle of the day usually is pretty good, but we do see a noticeable and measurable drop-off towards the end of the day. This is the key feature that we're trying to address. Comfort studies where we've measured this thing suggest that it's not the lens that's changing through the day, there's something about the eye that is altering as the day goes on. So some clues there that I'll be picking up on later. And even though emmetropes have the best ocular comfort overall, even our spectacle wearers complain about some issues relating to discomfort as well. In the remaining talks of this series, I'll be delving even further into the causes of contact lens discomfort, and then also finalising with how we can best manage this situation and make sure that we minimise the number of people who drop out because of contact lens discomfort.